All right, I think we're going to go ahead and get started in the interest of time. So welcome everyone. My name is Tracy Townsend. I'm an account manager with Connie. I see a lot of people on the call today, so we're very excited that you could join us today. Let me orient you to a couple of things in the Zoom interface. If you look at the bottom, there's a Q&A button and there's also a chat button. If you have questions, we ask that you put those in the Q&A and we'll try to get to as many of those at the end of the webinar as possible. Any questions that we do not get to, one of the account managers from Connie will get back to you following the webinar. I did have someone ask if there's any documents or handouts that go with this webinar. We don't have anything to send out right now, but following the webinar, we will be sending out a recording and also the slides. And you're welcome to contact any of us to ask any additional questions that you have. So with me today, I have Amanda Crociata. She is also an account manager with Connie, and she's going to be going through the Connie overview slides. She's going to be giving the background information and the current state, how to join Connie. Then we're going to turn it over to Ryan Bramble, and Ryan is going to go through a demonstration of the Connie portal. We'll use the remainder of our time for questions and try to get to as many of those as we can. Also on the call is Lakeisha Moore. She's our senior account manager with Connie. So that's the Connie team, and I will go ahead and turn it over to Amanda to get started.
Thank you, Tracy. Welcome, everyone. Thank you for joining us today. I will get started today with just a little bit of background on Connie. So we'll start with who is Connie. Connie stands for Connecticut Information Exchange, and it was set up by state statute to be the designated Health Information Exchange, or HIE, for the state of Connecticut. For those of you that don't know, an HIE, or Health Information Exchange, is an organization who provides the technology and services to allow for a secure and efficient clinical data exchange among its participants. And our participants are typically hospitals, health plans, provider organizations, providers, labs, and even some state agencies and pharmacies as well. So Connie was set up to be independent, not-for-profit, neutral and trusted organization. While the Office of Health Strategy has some administrative oversight over us, we are independent and have an independent board of directors. And neutral and trusted are two very important principles to us. As a neutral organization, we are not set up to benefit any one part of the health ecosystem over another. So we're not here to benefit hospitals over provider organizations, or health plans over patients, or state agencies over providers. And trusted, meaning that everyone gets to have a say and a voice in Connie. We're an organization whose board meetings are public. We also invite representatives from participating organizations onto our Operations Advisory Committee, and we utilize their feedback to guide our governance and operations activities. We were set up to be a network of networks model, in that we know that Connecticut was a little bit late to the game in setting up a statewide HIE, and during that time, there are other entities that have built technologies to be able to exchange data. So with that, our goal is not to disband those networks. Our goal is to connect those networks and enable the further exchange of data. So before we move on with the presentation, I just want to share with you all a brief story. This is a true story. This is Brenda and her mom, Carol, and although this is a stock photo, it's not actually a photo of Brenda and Carol. This is a true story about them. So Carol is an independent and lives alone, and Brenda is her main support. A few years ago, Carol got sick with what her PCP and her local urgent care said was pneumonia. She was prescribed several medications and advised to stay at home and rest, but wasn't getting any better. So after a few days after being diagnosed, Brenda went to check on Carol, and what she found was every adult child's worst nightmare. Carol was lying on her couch, weak and clearly deteriorating. Brenda noticed that Carol's ankles were swollen and frantically drove her to the nearest emergency room. At the ER, the nightmare got worse when the ER staff asked Brenda for a list of her mom's medications and past medical history, and Brenda had assumed that the staff would be able to access all of this because Carol's PCP office was on the hospital's campus. But unfortunately, they did not share the same EHR. So the hospital staff could only rely on what Brenda could recall of her mother's medication history. And in the end, Carol was diagnosed with a busted mitral valve and needed open heart surgery. So she has since recovered, but the incident has made a huge impression on Brenda. And the Health Information Exchange, is really in place to prevent scenarios like these that happen all too frequently today. So Connie was established to enable the better sharing of clinical information across healthcare settings. We know today there's a variety of ways this happens, whether it's by faxes going back and forth from a hospital to a primary care group or a PCP to a specialist, for example. And we know that if you're a member of a certain network, you might be able to share between members of that network, but not necessarily get data from another network. So the idea here is to enable the sharing of data across all healthcare settings, which would support better care coordination, help reduce preventable costs associated with readmissions and duplicative testing. And because if you're able to query Connie to find out if your patients had a certain test and you can see the results of that test, then you may not need to repeat it. Connie will also ultimately end up serving and supporting public health reporting, research, and population health analytics as well. And as the pandemic has shown, that's something that we need now more than ever. Additionally, we want to make sure we adhere to and promote standards of interoperability. And finally, the state mandate and the Office of the National Coordinator does require that we provide patients access to their own health information. That's something that we already have in the works. It's something we have a working group actively planning and looking at what this functionality will look like. So a lot of you probably asking, are you required to join Connie? So the short answer is yes. And I'll go through a little bit of the participation requirements here with you. Connie commenced operations on May 3rd of 2021. And the state statute says that hospitals and labs have 1 year to begin connecting with Connie, and all other healthcare providers have 2 years to connect to Connie. Connecting to Connie means sharing your patient's demographic and clinical data with Connie. Now with that, we have received some additional guidance from the Office of Health Strategy to more clearly define the mandate to connect to Connie. As it stands now, and this is subject to change, we anticipate hospitals will need to sign the Commitment to Connect form by May 3rd of 2022. And by December of 2022, we expect that they will need to have real-time ADT or admit discharge transfer feed, and have 2 additional data feeds from the list you see here, and provide Connie with a provider roster as well. And then by May of 2023, all other feeds you see listed here will need to be live with Connie. Labs will need to have signed the Connie commitment form and, Connie Commitment to Connect form by May 3rd of 2022 and start sending lab results by December of 2022. And I do want to take some time to explain some of the acronyms you see listed here. So I'll start with CCDA. So CCDA stands for Consolidated Clinical Document Architecture, which is a standardized structure for the clinical care summaries that you will see in Connie when you log in. And lab ORUs are essentially the lab result messages that you will see within Connie. Radiology ORUs are the radiology result messages that you'll see within Connie. And image share is a new use case that we're really excited about. It's now live in Connie, where providers can access radiology images in full diagnostic quality with reports in the clinical portal. The MDM or ORUs are document feed messages, for example, notes, transcribed documents such as discharge summaries and consults. I'll go into the next slide here, and this is a little bit about the mandate requirement timeline for ambulatory practices. Now I want to preface this with this is not finalized yet, but we anticipate that the items listed here will need to be completed by May of 2023, including signing the Commitment to Connect form and sending a patient panel or roster to Connie as well as CCDAs. So Connie is building EMR hubs to help make connectivity easier for smaller practices. Some of you might be sending us manual patient panels securely every 60 days or even more frequently. And we hope to set up these hubs to help alleviate some of that manual work that your practice might be doing. We currently have hubs set up with Athena, Greenway, and Glenwood systems and are in development with ECW. But if you are already connected with Connie and are interested in having us reach out to your EHR and get those technical integration discussions started, we're happy to do that. Feel free to reach out to your Connie account manager to kind of get going with that process. So next I'll tell you a little bit about who has joined Connie. And I'm happy to say that this slide is very out of date because we've been connecting providers left and right. So these are just some of the organizations that I've connected to Connie so far. And some of these organizations are legally connected, meaning that they have signed the legal agreements and they're beginning to determine how they want to contribute and view data. And some are actually live within Connie and actively exchanging data. And we now have over 3.1 million patients in Connie, so that's a great start for just such a young organization. And we are keeping an updated list of participating providers on our website. So if you're interested in seeing who is currently connected, you can go ahead and check that out online. So I included these slides to kind of give you an idea of some of the data Connie is currently receiving from our connected providers. This is also changing by the minute, but as of now, you can see here, we have 51% of the state's hospitals are providing real-time ADTs to Connie. That's including UConn, New Vance Health, Bristol, and Connecticut Children's, and 2 are providing CCDAs, Children's and Sharon. 3 hospitals are providing lab feeds, Bristol, Sharon, and UConn, and 6 hospitals are providing radiology feeds, Bristol, New Vance Health System, and UConn. And 5 of those are providing images as well, which is really exciting. Bristol and UConn are also providing document feeds to us as well. And then for some of our other providers, 51 organizations are providing CCDAs, and Quest is actually forwarding over 300,000 plus labs monthly to Connie. So what information does Connie exchange? These are the available use cases today, and currently connecting to Connie means signing on to 2 of these use cases. The first you see listed here is empanelment, which is where you would submit a roster of your active patients. This essentially establishes a care relationship between you and your patients, and it adds security because no other providers can access those records unless the patient is also listed on their active roster. So that said, you can still see a patient's record who's not on your roster. So for example, if you get a new patient coming in, you can still access that record, but you'll need to go through an extra layer of security called breaking the glass, which Ryan might show you a little bit later in his demo. This is basically where you have to attest to a relationship with that patient. And we keep audit records of who has broken the glass to see patient records and why. The next use case is providing clinical data, and there are a number of ways that this can be achieved. We can work with your EMR vendor to set up an interface and get real-time HL7 messages, or we can accept clinical documents in the form of CCDAs that I mentioned earlier. And Connie has partnered with CRISP Shared Services out of Maryland, who also provides technical infrastructure to a number of other state HIEs. And their technical team has worked with most EHR vendors out there. So the technology that we're using here at Connie is tried and tested. And we have a very experienced technical team who can work with your vendor to get this data flowing. And a third and optional use case is the Encounter Alert Service. And this is where you can receive alerts when your patient is seen in an acute care hospital. And right now that's limited to Yale and Hartford, but we hope to expand that to other organizations. And again, this is an optional service, but you can let us know if this is something that you might be interested in. Just on the topic of use cases, we'll be bringing on a number of additional use cases in the coming year. I mentioned image exchange earlier, and we also added access to the Connecticut PMP database within the Connie portal. And additionally, we'll have some new and exciting services and use cases over the coming months and years as well. So there are 3 ways for healthcare users to access data in Connie. We have developed a Smart on Fire app called In Context. That's the first one listed here up top, and that can be embedded into certain EMR products. Right now, this app is installed into Epic, Cerner, eClinicalWorks, and Athena, and we hope to add more vendors to the list. And In Context is designed to present HIE data within the context of a provider workflow within their EMR. So it's a single sign-on. You don't have to, log on separately to the portal to view your patient information. You can access the portal right from an icon within your EMR system. And the second way to access is through the Connie portal, and this is a standalone web-based portal. And you'll sign in with the username and password, and we do have 2-factor authentication for added security for that. Here you can search for your patients and view records from any other provider who's connected to Connie and has that patient included on their roster as well. And in a few minutes, Ryan from CRISP is going to show us the Connie portal so you can kind of see everything in action. We can also work with your EMR vendor or IT staff to develop an inbound data flow from Connie that could be ingested into your platform. So we're exploring how to do that as well. So if that's something that you're interested in, that's just something you'd want to mention to your account manager as well. So next, I'll go through a little bit about patient privacy. In Connecticut, patients are opted into the HIE by default. They have the option to opt out of having their data shared within Connie at any time. There are a number of ways a patient can opt out, including a form on our website. They can email or call our customer care team. And the website also has some frequently asked questions for patients and for participating organizations. We've developed a communications toolkit that can be used to inform your patients of your participation within Connie. And we will have a brochure and some sample language that you can also incorporate into your notice of privacy practices if you so choose. Additionally, we have a letter template that can inform your staff and other stakeholders that you're participating in Connie. So that toolkit is available to you as well. So how do I join Connie? The first step is to let us know that you're interested. You can submit a commitment to connect form through the Connie website, and that form is on our website. You can submit it to info@conniect.org, and this just lets us know that you're interested and gets the process rolling. The second step is to make it official. So we would meet with your organization and send you a package of legal documents out for your review and signature. This will include data sharing agreement, any use cases you decide to sign on to. The third step is to meet and discuss data. And essentially, here's where we talk about what data you'd be contributing and what data you are interested in viewing. And the fourth step, you're connected. So you can share the news internally and externally, and you'll get some training and a communications toolkit so you can start letting folks know that you are sharing data with Connie. And then 5, of course, we want to keep in touch with you. We're looking at setting up some user group meetings. There's an operations advisory council if you choose to participate in that as well. We welcome your feedback and really want to know how Connie is working for you. And that's really it for me. But with that, I'll turn it over to Ryan from our technology partner, Chris, for a demo of the Connie portal.
Thanks, Amanda. All right. Amanda, you can see my screen okay? Making sure. Okay, cool, thanks. All right, so I'm gonna demo a couple of the services that are available through Connie. I'm gonna be demonstrating these in the Connie portal. As Amanda mentioned, there are different ways to access Connie. One is through our In Context app, which is directly inside the EHR. But for other folks who are accessing the web, you would log in, and this is the screen you would land on, and you would do a patient search. I have access to a lot of different apps. Most users would have access to 2 or 3 apps, depending on their role in the organization they serve and their role in taking care of the patient. I've done a search here for our first test patient, Connie HIE patient, and I'm going to show the break the glass capability, which Amanda mentioned, which is a privacy and security capability. Essentially, when you participate with Connie, due to the nature of the data you're sharing with us, we know the relationships you have with your patients and the relationships you don't have with patients. If you were to look up a patient that you don't have a relationship with, you would get this warning that we don't think you have a relationship. Do you want to proceed? You would then have to pick a reason, and then that reason would be audited by the privacy security team at Connie. Most of the time, this won't happen to you all because you'll be interfacing or sending us patient panels that communicate what your relationships are with patients. But this is helpful if you're in an emergency department or a place where you may be establishing a new relationship with a patient and want to do a search for them. Then you can break the glass and that would be audited. I'm going to jump over to our other test patient, Anna Cadence. You can see here that I put in the search field Anna Cadence and then the wrong birthday, and that there are actually 2 Anna Cadences that live in different locations with a different birthday. Our search is not exact, so if you are not entirely sure of a patient's name or you misspell it or you transpose some dates, the system should still find the patient you're looking for. And that will launch our In Context health records clinical information page here on the right side of the screen. Your apps that you have access to will remain on the left side of the screen, so you can hop into them. You can shrink this to make this bigger, and you see that menu actually gets a little larger when you do that. Inside here, I'm going to highlight a few different things: clinical data section, information related to care coordination, and information related to patient demographics. And then after this part of the demonstration, I'll show you the image exchange, the image share capability that Connie has, And then we'll show you the prompt system, which allows you to be notified in real time when one of your patients has a hospital encounter without having to necessarily log in, but I'll show you the ways that you can view that data through the login. All right, so the first screen you land on is the All Encounters tab. You can see there are a few encounters here: an emergency room visit, an ambulatory visit, and a couple ambulatory visits. If you want more information about the emergency visits, for instance, you can click hospital, or for the ambulatory visits, click outpatient. And you can see that this was a gastroesophageal reflux disease visit, and sort of what happened after that visit in the encounter section. Likely, you might want more information. Maybe you're just checking to see if the patient did the visits they're supposed to do after a follow-up appointment. But you may want to see, obviously, clinical information related to these visits and these hospitalizations. And you can do that by clicking on the Health Records tab. This is grouped into 3 categories: lab results, radiology reports, and notes. These are notes, basically the providers dictating or typing into the EHR. If you just want to see labs, you can click on the laboratory section, and that will shrink the results just to labs. You may be looking for a specific lab, and if you are, you can start to search by typing, but hit the search bar and then start typing. So if I'm looking for a complete blood count, I can do that. And then I can click it to view the actual complete blood count. We work with each data contributor to Connie to make sure that the flags work. And so that if a lab is below or above normal, as you can see, this one is below normal, it gets appropriately flagged. And you can download this as a PDF if you want to print it out or attach it to a chart. You can see this is flagged out from the outset. So if you're really just looking at a list of labs for abnormalities, you can see that here in the left-hand column. You can see we have some cameras too. That's the image share capability. So if I'm looking for radiology reports, we get both the report and the image. It's 2 different integrations. So we will start with an organization by getting just the reports. And then as the technology is installed to do the image share, you would start to see cameras to identify that there's an image available for these reports. And so a radiology report is exactly what you'd expect: the impression from the radiologist of the visit, of the image. And if you want to see the actual image, all you have to do is click on the little camera. It's going to pop up a new tab in your browser. You don't have to leave your browser, and then the image will appear. This image viewer has functions that are similar to functions you might use in your own office around viewing images, things like measuring different parts of the image. If there were multiple images as part of this study, you'd be able to sort of scroll up and down through the different images and mark them up and do whatever things you might do as someone evaluating an image. The image share works by, we will have about 90 days of images, and then there are older images available as well. If you're interested in seeing all the images a patient might have, due to the nature of the way this works, the imaging device is always connected to the hospital or the radiology center sending the images. So it can go back quite a long way, even before the organization started participating in Connie. And then the last section would be the notes. This is usually the section that folks go to a lot, especially when there's a hospitalization that you're looking for information on. This is the dictated notes, in this case, of a procedure. And you can see it just explains the whole procedure, just like you would see in a typical transcribed note, operative note. Also downloadable as a PDF if you're interested in doing that as well. We also, as you heard Amanda say, are connected to connecting to a lot of practices. Practices will often generate what's called a CCDA, a continuity of care document, as Amanda explained. This is a summary of care from an ambulatory visit. And so if you know a patient has had a visit at an ambulatory practice or with a specialist, you would click on one of these to view. And let me click on, it's hanging up a little bit. I'll explain what as I wait for this to load, I'll explain what a continuity of care document is. So Instead of, here we go. Instead of sort of all those discrete fields, a continuity of care document is basically a summary of the entire visit that happened at a practice. So as the doctor is going through the entry into the EHR, the medications list and the problems list and procedures and vital signs, that gets generated in the CCDA and then is sent over to Connie at the close of the encounter. So you're seeing everything here that's really documented by the provider during a visit in the EHR. If the doctor then subsequently sends the patient out to LabCorp request or to a hospital to get lab work done, that wouldn't be in here because it would happen after the visit. You would see that over in the health records section in the labs. And so the structured documents is a good way of understanding the most recent well care or primary care visit, specialist visit. But the health records tab is the best place to see sort of the stream of results that are coming in. As far as other data, so we are working to link up to immunization registries. And when we do that, that data can appear here. As Amanda mentioned, we are the HIE infrastructure for not just Connecticut, but for other states. And one of the cool things about that is when another state invests in enhancing this system, those features are able to be used by other states without much more investment. So Maryland, for instance, has done a lot with immunizations, and thus that's available once that endpoint is sort of connected to. I'm going to jump down to the care coordination tab. The most important thing we're showing here is the care team. So as you enroll in Connie, as your office enrolls in Connie and submits a patient panel or sends an interface of data, we display that to all providers in the Connie network so that that provider can see what relationships might exist. This is especially important if, for instance, you've enrolled a patient in a care management program and you want to make sure that the provider who's looking up this patient's records follows along with the care management plan or the pain management plan or the home health plan for the patient. And that can be facilitated not only by information exchange, but also just telling the provider, you know, what programs this person is in and who their lead care manager is. So for instance, in this case, Paige Brennan is a care manager for this patient. I can hover over the eye here and see how to contact Paige if I have questions about the care management services that this person is in. And just by submitting a panel to the Health Information Exchange, you can start to populate this section. And then we have patient information. Point this out for two reasons. One, if we are provided the next of kin from a facility, that will show up here with contact information. And two, to show that we will show the most recent contact information in this section. So you may, if you're having trouble locating a patient, maybe the records in your EHR are old and you know a patient, you've been notified that a patient's been to the hospital by Connie or another means, but you can't contact them. The most recent contact information will always show in the demographics section. So if you need to update your systems or trying to reach somebody, this is usually a good place to check. A few other things before I jump over to the prompt notification service. We give you the ability to send feedback. So you can click this button and send us both regular feedback and also issues you find. It's an encrypted submission. So if you find patient data you think is inaccurate or incorrectly linked to a patient, you can submit that through the feedback section. The product update section will tell you about the new features as they get rolled out. If you click on your name, you can adjust things like your password and your profile. So let me pause 1 second and we're just going to switch screen shares. Lakeisha, if you don't mind sharing your screen, I can walk folks through prompt.
Absolutely, thanks. And I know prompt is a new service for us that Connie's offering. So I told Ryan, I was like, I'm glad to share my screen. He'll just have to point me in the right direction. So let me go ahead and share, and then we will go over this together. Give me 1 second.
So with prompt, I'll just kind of set it up as you're getting it going there. Prompt is a tool that allows you to see your patients and all of their hospitalizations. So I just demonstrated to you the way to go in and type in a patient's name and look for information on a patient. The point of prompt is to proactively, which is the first part of the prompt name, let you know when encounters are happening. Now, Prompt is the web-based way in which we demonstrate this. So right within the same login and clicking on the same tiles, you can launch Prompt. You'll land automatically on this screen you see on your screen, and you're going to see that Nat demo was at Yale New Haven in the emergency room on February 24th. And was an inpatient and moved to outpatient. There you can see that in the event section. And these appear as they happen. Now, if you're looking for specific types of people, you can click on the filter button there at the top, and that will let you create a filter that you might want to summarize this by address, by zip code, by age, by the last 30 days, by certain statuses. This filter will let you do that. So you may not be interested in everybody on your list. You may be interested in only certain people. Those filters will let you do that. And you can sort and arrange this list any way you want, or do an actual search of the name at the top right there. And then you also see the download, the little cloud with the down arrow. That will allow you to download all of this into an Excel file. You may want to manage this in your own system using Excel. Now, this is the web-based way in which we can push notifications to you when your patients are having visits. This is also available in other more integrated ways, other more integrated mechanisms. We can securely send you an Excel file every day. We can send you an interface into your EHR. And so if you'd rather do it that way, just speak to the county team about doing that. But this is the easiest, most straightforward, sort of right away way to get into Prompt. Lakeisha's highlighting there the statuses. Some folks like to use this as a triage. So the office manager might come in the morning, open up Prompt, see the hospitalizations that happened in the last day, and then start making phone calls for follow-up visits. In some cases, there's special reimbursements for providers from the federal government when you do that. And so if they are able to reach somebody, they may change the status here on to completed. If they're left a voicemail or something along those lines, they may change it to in progress. And then you can filter this list so they could come back later in the day and try again. And so it's a little bit of a basic patient tracking system. But as I said, you can download this as an Excel file and ingest it into your own systems if that's your preference. And so the Prompt tool is a really cool way of knowing what's happening. And then the clinical information tool is a really good way of actually getting into the details of these visits if you're interested in doing that. Lakeisha, I think that's it for the demo for me. Turn it back over to Amanda.
Great, thanks, Ryan. I know Amanda and Tracy have been kind of looking at the Q&A, the Q&A section questions as they've been coming in. So thank you all for your engagement and joining us. It's always awesome to have Ryan with us as one of our technical partners, just because with their HIE that we've partnered with, the Health Information Exchange in Maryland and DC, they definitely kind of have given Connie a lot of just feedback and things, lessons learned as we're launching our Connecticut HIE here at Connie. So I'll turn it back over. Tracy, I know there were several questions that you were kind of going through and answering live, but there may be some that maybe we can go over either with me or Ryan or anything that Amanda C. covered. I know because of the amount of folks that we had on the line today, there's several questions that we'll need to follow up with after the webinar. And just I kind of saw a theme as I was peeking at the questions too of folks asking if we would have this recorded for training or just to share with others. So absolutely, as long as you registered for the webinar, even folks that registered and weren't able to join us live, as long as you registered, we'll send out the slides that Amanda Cruciato went over today, and then we'll also send you a copy of the actual recording. So Tracy, I'll turn it over to you to go over questions.
Okay, so one question we had was, does Connie allow for patient authorized use cases such as insurance? And Lakeisha, is that a question that you can take?
Yeah, I won't go over that live right now because I know we're doing a lot with looking at our roadmap and patient use cases. So that's definitely one we can kind of take back, Tracy. And I think for everybody, we didn't allow anonymous questions. So the email that you use to register, that too will follow back up, or what we can follow back up with directly. But definitely on our roadmap, I just want to make sure that I can answer that fully. And I know it'll be a little hard to do that live during the webinar. Thanks.
Great. Okay, thank you. And then we got a lot of questions regarding non-medical agencies. Homemaker, companion agencies. So right now the mandate is for providers only and to specific skilled agencies. But that said, I believe that we are working with some of the home and community care services to see what kind of access can be provided. Of course, that would need to be vetted through HIPAA requirements and things like that. We wouldn't want someone to have access to a patient's record that's not supposed to. But that is something that we are currently exploring now. Okay, here's a question. Does Connie provide two-way data for home health agencies? So if our EMR connects with Connie, it sounds like we can send information out, but can we also get information in? Can our EMR pre-populate a med list, patient demographic, or insurance ID information if we have it sent through Connie? Would love to see this reduce manual admin work for referrals. Let's see. Ryan, would you be able to take that question?
Sure. The answer is going to depend a little bit on the system you're using, and home health agency systems, EHRs. The capability they might have is usually not as sophisticated as a one that was maybe under meaningful use dollars and got incentives. But if your EHR can consume data, there is some data that can be consumed from Connie. We do try to push folks to use the In Context app right inside the EHR, because it's doing sort of one-off integrations to everybody, both directions, can be a little time consuming and might take a long time, but there are elements that can be pre-populated. So if you were to subscribe to the notification service, for instance, when you received an alert that your member went to the hospital, you could consume demographic information, insurance information through that interface. We're working on meds lists. Connie folks have a best possible medication history group that's meeting to determine what the best way is to share medications lists and what to call those lists. So, mostly the answer varies depending on the capabilities of the EHR, and I think it could be something that can be discussed.
Thank you. All right, just looking to see if we got to all the questions.
While I know Tracy's going through the questions there, I believe we had set up the webinar where participants are automatically muted. So if you do have a question, if you can put it in the Q&A, because I saw some folks have their hands raised, but if you're able to put it in the Q&A, that just will work a little bit better with the amount of folks that we have on the webinar. I didn't want you to think that we were didn't see your hand raised. It was just to kind of eliminate some of the distractions. Sometimes when we have folks' mics opened, I think the default on this Zoom webinar was to have everyone muted. So if you can put your question in the Q&A section, that would be really appreciated. If it is something that you still want us to follow up with you directly, we're happy to also follow up after the webinar directly. I saw some folks asking about like training or using this webinar for training. We do have some specific webinar, not webinar, but actual video clips of just us going through the Connie portal. So that's something that definitely, if you're an organization that's already signed data sharing agreements with us, we're happy to send you over some materials or to even schedule a live demo training with you and your staff, just because we want to make sure you have the materials you need. I'll pause there, Tracy, in case there were other questions that we wanted to go over live.
It looks like we have a lot of questions from, it looks like we have a lot of attendees from non-medical agencies asking about, if they can get access to Connie or if they're mandated to join Connie. So I know for myself, I would need to follow up with some of our team members on that. So I think any types of questions like that, we can get back to you after the webinar. Oh, we have a lot of questions here. Okay. Where will code status / DNR data be populated for a patient being transferred? Let's see, Ryan, can you answer that?
So those use cases around directives and do not resuscitate orders, those types of things, Lakeisha, you might be able to talk better about where those are and sort of the pipeline of use cases.
Yeah, I know have it on our roadmap, Brian, but it would be kind of interesting to hear. I know just because the HIEs that you're working with in Maryland and DC kind of already have some of this provided out. So maybe we can talk about what's possible or what you've seen best practice wise. But to your point, I know it's on Connie's roadmap, but we don't have that live as of today. So it's not like we have any type of DNR data that's populating currently in our Connie portal.
So in other states where we operate, they collect they don't collect, they actually link to patient websites where patients can go and submit advanced directives. And then in one state where we operate, they're currently integrating with the medical order for life-sustaining treatment database. And where that shows up in those states is in that care coordination tab I showed you. You saw the care team. There's another tab that would appear that says advanced directives. And in that tab, you can actually view those orders. And again, a lot of that is bound by state regulation as to how that will look. So it could look a little different when it comes to Connie, but that's how it's working in other states.
That's helpful, Ryan. Any additional questions, Tracy, that we wanted to go over quickly live? I know we'll have quite a few to follow up with. Typically, our account managers are split out by regions. We've kind of split the state into regions. So typically we'll look at the organization where your organization is located, and that's the account manager that'll follow up with you and will be a nice contact for you to have going forward as whatever stage you may be in with connecting to Connie.
Yeah, I have one more. Is Connie managed by the organization's IT department? So once you sign the legal agreements with Connie, your account manager will schedule a call with you and your EHR vendor or any IT staff that you have, and we'll talk about the best way for you to connect. And depending on who is responsible for creating the interface or the data feed, that's who would be managing your connection. Let's see, I'm the manager for a provider who is affiliated with Yale. We have not used Connie yet. How does my staff get access to Connie? So if you're using the Epic Community Connect through Yale, I believe that you can access Connie through In Context. So you would want to contact either Epic or your Yale contact who is responsible for your Epic license, and ask them how you could view the data in Connie through Epic. If you're not on Epic, then contact one of us, and we can talk about getting your EHR connected. if you're not connected already. So you can access the data through the Connie portal. Depending on who your EHR vendor is, we might be able to send data directly into your EHR. So it just depends on who your EHR vendor is. Does Connie connect with SAN data? That's a state app. Not currently, and I'm not sure if that is on the horizon. I don't believe it is. Lakeisha, have you heard anything about SAN data?
Not yet that I've heard of. We do have one of our program managers here at Connie works directly with the state and Office of Health Strategy and some of the other state agencies, DSS, et cetera. So I can definitely ask her about that. But to my knowledge, we don't have that on our current roadmap. Doesn't mean that it couldn't come down the road if there's interest there from the healthcare provider community. But as far as I know, right now, we don't have it on our current roadmap.
All right. Do we have any other questions for today?
There's a little bit of a delay, I think, in them coming in, Tracy. So if we have like one more that you already had in the queue that we didn't go through, great. The others, any others that do come in, we have a transcript of this particular recording, so we definitely can make sure to follow up directly if we didn't get a chance to answer your question live. And I saw you and Amanda C were kind of feverishly going through and typing as quick as you can with a lot of these, but I know there's some of them, like the Yale question. I think that was Michelle, and sorry if I'm not saying that right. We definitely, Tony is our other account manager. We're kind of a small but mighty account management team, so it's 4 of us total. Tony is the account manager for Yale. He works really closely with Amber Patterson. And so definitely Tony can get with Amber and with you just to find out how we can get your org access to the Connie portal. I know for many of the Yale Community Connect practices, we are doing kind of a, I won't call it stage, but we have been onboarding those practices in cohorts. So we had a group that we onboarded back in September. And then I know now the hospital itself is queuing up to send over ADTs, CCDs, sorry for all the acronyms. I know Amanda C went over them during the presentation. But many of those hospital feeds right now, we're working to get those connected because of the May 3rd deadline. But I know after that, after we get a lot of the hospital feeds going, the labs, radiology, any other feeds the hospital sending, our next focus, of course, will be the ambulatory practices, since the deadline for ambulatory practices to connect is May 3rd of 2023. So all that's to say, appreciate the engagement with everyone today. This was really helpful. This is our biggest probably crowd yet since we've been hosting these monthly webinars. We are looking to start another webinar series that's for a lot of our organizations that are already onboarded or maybe doing special projects like the home and community-based services. I think many of you may have been on the webinar today, which is really exciting too, because that's kind of a different group. You may not be necessarily HIPAA covered entities, but it's still a group that we want to engage, recognizing that you're providing patient care. So lots of use cases out there. We're excited to kind of look and delve into a lot of the things that are needed in our Connecticut healthcare community. So once again, thanks again for joining us. I'll turn it over, Tracy, if you had any final burning questions that came through or just closing thoughts. And then of course, like I said, we'll follow up with everybody after this webinar. We typically will try to get out the recording and get to any of your questions. This is, like I said, probably the biggest amount of questions we've had. So if you can give us to at least like the middle of next week to kind of go through and triage, that would be appreciated. But yeah, we usually try to get this back out to you quickly so that it's not lingering. Thanks again.
Let's see. So one last question here. As part of providing the slideshow, please provide an acronym definition list. So lots of acronyms. I don't know if we have a definition list currently readily available, but that is a great suggestion. So we will put one of those together, at least for the acronyms that were in the slide deck today. All right, I think we will close out our webinar for today. Thank you so much for your participation and all your questions. We have some great questions here, and we'll be working hard to get answers to you over the next week. So thank you very much, and hope everyone has a great day.